Hospice is a program in which healthcare professionals come to wherever you live to provide care. So if you live at home, then they will come to your house. If you live in an assisted living or other residential care facility, they'll come to that facility. It is a program for people with a terminal diagnosis and a prognosis of 6 months or less. So those are qualifying factors. Hospice is meant to support not just the patient themselves, but the whole family system. There's a RN case manager that oversees the care, the social worker, which is myself, chaplain, if families want, and also CNAs to help with bathing and grooming. And then, of course, we have our physicians overseeing as well as management and volunteers who can come and provide respite for your family members. So it's a very wraparound based type of care where it's not just medical care that's provided, but it's emotional support, grief support, resources, access to financial resources and that sort of things through the social workers' awareness of community resources that are available. So that's hospice. What makes palliative care different is that palliative care is for people who are living with serious illness. And so you don't have to have a prognosis of 6 months or less. Usually what that means is that someone who has cancer, perhaps heart disease, and are looking for additional supports. Palliative care can really help with symptom management, like pain management. Palliative care helps with talking through what you would want to happen next. So they're really good at having family conversations, talking through what people's desires are, what quality of life looks like for them. We like to talk about palliative care as just extra layer of support. It's not as robust as hospice because hospice is a Medicare benefit. If you have Medicare, you'll be able to receive all of those visits, all of those people coming into your home with no cost to you. Private insurance as well often covers 100%. Palliative care is just like any other specialist. So you're billed just that way. So if you're on Medicare, it's an 80-20 split, just like your other providers. And so with that in mind, you can understand you're not going to get 5 visits coming in a week or something like that. And then again, the additional supports can complement that. There are social workers and chaplains involved. It's just to a little lesser degree than on hospice. So hospice only end of life, palliative care during your illness, throughout your illness. Palliative care, you can continue to receive all of your treatments. Hospice care means that you're no longer pursuing curative treatments. You're focusing on comfort. So that's a pretty major distinction as well.